Here we have CT of the brain in 19-year-old with history of head injury. From the point of head injury, there is nothing to look at. What I want to show here is the abnormality situated in the midline. So how do I describe this abnormality? This I describe as follows. There is a well-defined triangular shaped CSF attenuation area situated between the lateral ventricles and superior to the third ventricle, posterior to the frontal horns of the lateral ventricle. If we go slightly lower, the temporal horns of the lateral ventricles are just visible. There is no evidence of compression on the third ventricle. The corpus callosum is visible posteriorly, and there is no evidence of agenesis of the corpus callosum. Lower down, the fourth ventricle and the craniocervical junction appears normal. You can also do the sagittal reconstruction to make sure the craniocervical junction is normal, which was normal in this case. So based on these appearances, what is the diagnosis? The common CSF attenuation areas found in the midline between the lateral ventricles are few. The most common one is persistence cavum septum pellucidum. The common differential diagnosis for persistent cavum septum pellucidum is cavum vergae. So what is the difference between cavum septum pellucidum and cavum vergae? Cavum septum pellucidum is situated anterior to the anterior columns of the fornix, whereas cavum vergae is situated posterior to the anterior columns of the fornix. So what is this? Neither of them. So now we come to the third entity, which is called cavum veli interpositi. It is also called cavum velum interpositum. So this is another anatomical variation where there is dilatation of the cistern of the velum interpositum. So this is not a CSF situated between the septum pellucidum. This is situated within a cistern. This is basically dilatation of the cistern, which is velum interpositum, and this is called cavum veli interpositum. Or now the question is it cavum veli interpositum or is it something else? So what happens is, if the AP dimension, if the transverse dimension is more than 1 centimeter, which is present in this case, then we try to call it as a cyst rather than cavum. So now we call this as cavum veli interpositi cyst rather than cavum veli interpositi itself. So we discussed four things here. The first one is persistence cavum septum pellucidum, which is situated anterior to the anterior columns of the fornix. The second one is cavum vergae, which is again situated anteriorly but posterior to the anterior columns of the fornix. Both cavum septum pellucidum and cavum vergae can coexist. The third entity we discussed is cavum veli interpositi, also called cavum velum interpositum, which is situated posterior to the posterior horns of the lateral ventricle. If that becomes dilated and the transverse dimension is more than 1 centimeter, we call it cavum veli interpositi cyst.